Hello everybody and welcome to the HacettepePathology.com. This month I'm going to show you a bone tumor. As you see here, we have a juxtacortical protrusion like here, and in the X-ray it seems that it's on the surface of periosteum, and the patient seems to be an adult, as we don't see any epiphyseal lines here. So I know she is around 40 years old. And on the CT, we have this mass on the surface of the bone in the proximal distal femur, and we don't have any involvement of the medullary space. And in the MRI, we see the same lesion here. And of course, they had biopsy, and after biopsy, they decided to take it out. As you see, this is the cortex here, and this is a partial bone resection. And as you see, the medullary cavity seems to be okay, and we see the cortex, and on the cortex we have this lesion, and this is the former biopsy area here, and this is a lesion. Some areas looks like the bone, and we don't see any cartilage here. And now I'm going to pass on the microscopy. And this is the lobus power. This is a normal cortical, the normal medullary area of the bone, and we see here is the periosteum, and just underneath the periosteum, and this is the former biopsy area, we see the parallel orientation of the bone, and in between we have spindle cells. And the spindle cells, they look really bland, and we don't see any nuclear atypia. They are monotonous, but they are accompanied by parallel bone trabeculi. And I think this is better. This is cortex here. Sorry for the sections, because it's a hard tissue. This is called lathering, jalousie effect. And this is the cortex, and within the cortex and on the surface periosteum, we have this proliferation. Actually, we don't see any proliferation here, but just we see is the parallel bony trabeculi. But here now we see the spindle cell neoplasm. Again, we see fibroblastic-like looking cells. We don't see any hyperchromasia. Maybe some scattered cells may have some hyperchromasia, as you see here in this area, but we don't see pleomorphism. We don't see any mitotic figures. The only thing is slight hyperchromasia in scattered cells. And of course, the main differential diagnosis is parosteal osteosarcoma, and nodal lesion is on the differential, and some kind of periostitis. And we ordered an MDM2 immune staining. We cannot do FISH on decalcified specimens. It was largely negative, but I have seen one cell here, just one cell stained for MDM2 in the whole specimen, so it's overall consistent with the diagnosis of parosteal osteosarcoma. Thank you very much.